Well, welcome back. We are going to start the second half of our program, and we're going to continue the theme of me introducing our distinguished ladies of our discussion period. So it's my pleasure to introduce our next speaker, Dr. Cynthia Thomas, who comes to us from slightly sunnier skies at the University of Arizona in Tucson, Arizona, where she's a professor at the College of Public Health and also the director of the Canyon Ranch for Prevention and Health Promotion. Her research area is really focused on dietary habits and dietary patterns for chronic disease prevention, and she's going to talk to us today about her research, healthy dieting patterns in the prevention of breast cancer and metabolic syndrome. Thank you.
Emily was nice enough to put a little stool here so you could see me over the podium. I want to thank the organizers for the opportunity to be here. I actually lived in Oregon as a young child, and my dad was a professor at that other Oregon university south here. And I was thinking as I was watching these slides, you live in such a wonderful place. We used to grab the filberts off the ground, and we used to have apple trees in the backyard and berry bushes everywhere. And we snacked all day long, all summer long, on all the wonderful produce that you have in this area. So thank you, Dr. Ho and Dr. Fry, for the opportunity to be here. What I'm going to do is talk to you about a topic that's near and dear to me, and that is breast cancer and the role of diet in breast cancer. And we're going to talk a little bit about what we know about certain whole foods in breast cancer prevention, how we can use these whole foods not only in relation to breast cancer prevention and improve survivorship after a breast cancer diagnosis, but also how these things may influence things like metabolic syndrome and diabetes, which are important in terms of breast cancer survivorship as well as breast cancer risk. So the one thing I do want to point out is that we're learning more and more that not all breast cancers are alike. And I think this is really important because I think sometimes when we look at the literature, kind of like the slide that was shared earlier, where one day they tell you eat this, the next day they tell you don't eat that, you know, all these different mixed messages related to breast cancer. Sometimes the issue is that not all breast cancers are alike, and we have premenopausal disease that can be very different from postmenopausal disease. We also have tumors that are expressing hormones and other tumors that are non-hormone expressing, and they have very perhaps different responses to diet and to therapy. And I'll give you an example. A few months ago in the Journal of National Cancer Institute, there was a meta-analysis of all the data looking at the role of fruits and vegetables in breast cancer risk. And what they found was that overall there was no association. And that kind of has been confirmed by a number of different association pooled analyses, including those out of Harvard from Stephanie Smith Warner. But when you looked at the subgroup of women who were at risk for ER-negative disease or the hormone non-responsive disease, there was a protective role. And so I think sometimes we need to think about what is the literature showing and what are they really looking at. How big is the problem of breast cancer? 230,000 plus women a year, 40,000 will die of the disease. It's the most common cancer in women, and it's the #1 cause of death in women 35 to 55. The good news in terms of breast cancer, as I've worked in this area for the last 20 years, is that we are making huge strides. And so we now have over 5 million breast cancer survivors, and they account for 41% of all cancer survivorship. So some of the information that I'll share with you in the next few minutes really speaks to the role of diet in cancer survivorship. So what do we know? One message that I think is really important to get across from our research is that eating less to get more is really important. Avoid, too much food, eat smaller portions, watch out for energy density. And there's a lot of association studies looking at the energy density of the diet and its association with breast cancer risk. And we did an analysis from the Women's Health Study, really interesting. When you just look at what women tell you they ate, energy or total calories may not be associated with breast cancer risk. But when we looked at it in terms of measured energy intake, in terms of biomarkers of energy intake, where we get over that self-report of women perhaps not telling us everything they ate, what we find is that energy is in fact associated with a higher risk for breast cancer. So eating foods that are energy, low in calories, higher in nutrients, you've heard this before, Penny just shared the same sort of thoughts. Make sure you try and get those energy-dense foods. And this is just a graphic that I like to use to illustrate, you know, you can imagine, and Barbara Rawls at Penn State has done a lot of work in this area, when you get those 400 calories from a really energy-dense, nutrient-dense diet, it fills you up, you get that satiety, and you get all those nutrients at the same time. And this is really the eating pattern that we want to promote in patients to reduce the risk of breast cancer. What about fat? Now, there's a lot of controversy about whether dietary fat is associated with breast cancer risk. We have a lot of evidence from studies where people have migrated from Asian countries to the US to westernized diets, and we see an increased risk of breast cancer. So that data has really driven us to look at fat as a risk factor for breast cancer. What we know is that we did a large trial, over 38,000 women. The dietary modification trial of the Women's Health Initiative ended about 5 years ago. We found that overall there was not a protective effect of a low-fat diet followed for 7.2 years. But when you looked at the women who actually were more adherent to the diet, actually lowered the fat the most from the beginning of enrollment to the over time on the trial, there actually was a protective effect, about 11% lower risk of breast cancer in postmenopausal women. Another thing that we know from the literature, and I've looked at this in survivorship as well, is that alcohol seems to be associated with risk of breast cancer. And in fact, one of the latest studies that came out about a year ago from the Harvard group suggested that even a little alcohol may be problematic. Even a few servings a week may be problematic. And that is below what is recommended in terms of the US dietary guidelines. Now, what's the issue with alcohol? Again, low in nutrients, high in energy. And it may also contribute to things like folic acid deficiency. Now, there is some evidence that binge drinking is particularly problematic in terms of breast cancer risk, and so we want to pay, a lot of people will say, well, I didn't drink all week, but, you know, Saturday night, come on. So be careful, make sure that you're aware of that. Now, there's some interesting data coming out from the literature suggesting that some of the bioactives in wine, for example, may actually act as aromatase inhibitors, and these aromatase inhibition is one of the things, one of the targets for drug therapy after a diagnosis of a hormone-responsive breast cancer, and so it may be that red wine is not as problematic. We did an analysis from our Women's Healthy Eating and Living study where we looked at alcohol consumption in women after breast cancer diagnosis, and we actually found that there was no increased risk in a recurrence of breast cancer. And what we also found was that women were drinking very moderate amounts of alcohol, on average less than 2 drinks a week, and most of it was red wine. How about vegetables? I think it's important to realize that we're going to encourage a diet that's high in a variety of vegetables. And you'll notice that I emphasize in this presentation vegetables more so than fruit. I think when you look at the literature on fruit, it's not as consistent in terms of a protective effect as it may be for vegetables. And so that's really why I chose to focus a little more on vegetables. I think sometimes when we send that message to our patients to eat more fruits and more vegetables, they get the fruit part, but they don't always get the vegetable part. And so just wanted to put in a plug for vegetables. And some of the vegetables that have been particularly shown to reduce the risk of breast cancer and perhaps recurrence are those that are high in carotenoids. So I give you the examples of the green leafy vegetables or the orange, yellowy vegetables that are high in alpha and beta carotene, as well as cruciferous vegetables. And I'm going to give you some examples. In the Women's Healthy Eating and Living Study, which I alluded to earlier, this was a study that enrolled 3,055 women across sites in actually Portland, also San Diego, Northern California, Arizona at our site, as well as Texas. And we followed these survivors for about just over 7 years, and they were randomized to either a well diet, which was very high in vegetables, more than 5 servings a day. They juice fresh vegetables every day as well, low fat, high fiber, or they were just given general information from the National Cancer Institute cancer prevention diet. And we wanted to look at overall recurrence and whether one diet was protective over another. At the end of the day, the survival rates were not different across these 2 diets. Either of these diets was associated with very similar recurrence rates in our survivor population. But there were some interesting findings. When we measured the blood in our survivors, we found that those with the highest carotenoid levels were able to reduce their risk of breast cancer recurrence by about 43%. And this is an article published in the Journal of Clinical Oncology by Dr. Cheryl Rock about 2009. So here we see a very protective effect of those really colorful vegetables, and also fruit will drive up serum carotenoids as well. And then I was interested, well, how do these work? How do these colorful bioactives help to reduce recurrence? And one of the things we were interested in was whether this higher level of carotenoids in the blood was associated with lower levels of oxidative stress in a breast cancer survivor population. And what you can see here is that for total carotenoids as well as alpha and beta carotene, there was a dose response shown in relation to higher levels in your blood, reducing your oxidative stress. So what about cruciferous vegetables? Cruciferous vegetables, I know many here at Oregon State have been working in this area. Dr. Ho, I heard Dr. Rod Dashwood speak early in the week on cruciferous vegetables. I was interested in the well women, whether those who ate more vegetables or more cruciferous vegetables had a lower recurrence rate. So what we did was we looked at total vegetable intake, and we found that overall we didn't see an effect, but we did see it in women who were taking tamoxifen. And so that was curious to us, and we thought, well, there must be something going on in terms of tamoxifen and these cruciferous vegetables. And in fact, Dr. Dashwood, Dr. Ho, and others have published quite a bit of basic science research suggesting that there are a number of mechanisms by which compounds in cruciferous vegetables, like isothiocyanate, sulforaphane, diindomethane, may be protective in relation to breast cancer, as well as other cancers, actually, and we found this interaction with tamoxifen. So we're following up on this right now. We're doing a randomized controlled trial with diindomethane in a randomized double-blind placebo-controlled intervention trial in women on tamoxifen to see if we can replicate these findings in an intervention design. So seeking variety is important, and most of you have seen the push for eating by the rainbow and trying to get lots of color, and I just wanted to make sure I got that message out there today. I think we have a lot more work to do to find out exactly, which may be preferential, but in the meantime, getting women to eat a variety of vegetables and fruit is important. I also want to point out that there's a lot of work going on in relation to spices. And so there's people at our institution looking at turmeric and many other institutions across the nation and the world. Also things like onion and garlic, wasabi and horseradish, which are high in isothiocyanates. Citrus zest, which is high in D-limonene. We are looking at the University of Arizona in terms of some of the breast density work. So just remembering that when you eat vegetables and fruit, there are a number of different compounds in the spices as well. And then what about grains? What is the role of grains in terms of breast cancer prevention and breast cancer health or breast health. And I guess the most important message that I want to get across in terms of grains is the impact that they have on circulating hormone levels. And this is also data from our well sample where we looked at the effect of increasing fiber intake on hormone levels, and we found a protective effect. This has been demonstrated in a number of trials. This was not unique to our research. And some of you may have seen this week, there was also an interesting presentation or publication looking at the role of exercise and hormones. And we see that there's also a pronounced effect of exercise on these hormone levels as well. So is there an additive effect when you eat a lot of fiber and you exercise? We hope so. We think so. Again, important behaviors. So too much food. That's definitely one of the messages that we all are trying to get out, that we need to eat less. And this part of the presentation, I just felt it important when we think about what we want to eat and whole diets and diet patterns, that we don't forget about the fact that breast cancer risk is somewhat associated with weight, particularly for postmenopausal women. And in fact, what we're starting to see is that increasingly where premenopausal breast cancer was not previously associated with BMI, we're seeing it more and more so that it is becoming more associated with BMI. So it is a concern. It's one of the main things we want to think about when we're thinking about diet patterns is how do we promote a healthy body weight. And I give you an example here. In our well women, we found they gained about 22 kilos over the course from age 18 to the mean age of 52 when they came on our diet trial. And in fact, there was recently a meta-analysis looking at weight gain during adult life and the risks for developing breast cancer, particularly after menopause, very high associations. So again, selecting a diet that's nutrient dense but not energy dense. So what about obesity after breast cancer? Is it associated with mortality after breast cancer? And what you see is that in this review by Potrani, there was an association with both pre- and postmenopausal breast cancer, as well as BMI and waist circumference. So several years ago, we did a study. This really came from our survivor population coming to us and saying, should I eat a low-fat diet or a low-carb diet, right? That's always the magical question. And so we said, let's test it. And I'll tell you that at the end of the day, when you stick energy, people lose weight. We didn't see any difference whether it was a low-fat or a low-carb diet. All of the women were able to lose weight over a 12-week period or 24-week period. And so what we found, which I thought was really interesting, we recruited women based on the fact that they had to have a BMI over 25. Interestingly, when we looked at the data, we found that at baseline, 53% of them also would be diagnosed as what we call metabolic syndrome, or as Penny mentioned, insulin resistance syndrome, that cardiometabolic syndrome. So a lot of our survivors are out there with cardiometabolic disease that sometimes is not going diagnosed because we're focusing a lot on the cancer prevention and making sure that they survive longer after cancer. And I would say that one of the things we need to do is really think about this population as a group that we need to think of diet in terms of cardiovascular health in these women, as well as stroke risk reduction, et cetera, diabetes risk reduction. With this study, over the 24-week period with the caloric restriction, we found that we lowered the incidence of metabolic syndrome, or the prevalence, by 50%. Now, in another paper published by the Well Research Group, and this one was led by Ruth Patterson at UC San Diego now, and she looked at different comorbidities after cancer, and what she found was, in fact, diabetes was associated with a twofold greater risk for recurrent breast cancer. So again, speaking to the fact that when we think about diet and physical activity in this population, we want to be aware that these comorbidities matter and that it's important not just to think of them as a cancer survivor, but also as someone who is at risk of these comorbidities. And that holds true for primary prevention as well. If you are diabetic, you have a higher risk of breast cancer if you are overweight. So when we think about diet patterns and breast cancer risk, this is a publication that was published by Dr. Patricia Thomson and myself in 2010, looking at the manuscripts that were out there and the publications looking at diet patterns. And what you find is that when we've looked at things like a prudent diet or the healthy eating index or a very vegetable-rich diet, we see that we have a lower rate of cancer. When we look at diets that are more predominantly Western, high in pork, processed meat, potatoes is another way it's been described, we see higher rates of breast cancer. And there are a number of mechanisms by which we modify cancer risk related to these meal patterns. So what does healthy eating look like? We want to say half a plate. A lot of people just need to be aware that we really do want colorful, high vegetable diets on their plates. How do we take care of weight? I'm not going to spend a lot of time on this, but basically when we're working with survivorship, it's the same story as we would have for other chronic disease risk reduction, making sure that people are doing these healthy behaviors in an effort to improve their overall health and maintain a healthy body weight. And I just throw this up here in honor of Melinda Manor and I were discussing last week how the role of apps and tracking and people's diet modification, and this super tracker that's available online has really been a wonderful tool for people to use in an effort to self-monitor. What about supplements? I tend to be a promoter of food first, again, for the reasons earlier speakers discussed, the importance of getting a variety of nutrients and bioactive compounds in the complex of the whole food is an important message to get out. But we want to evaluate people for supplements. We want to understand who needs supplements, and we want to look at supplements as something that supplements the dietary core, the dietary base of what they're doing in terms of healthy diet. There are American Cancer Society diet and physical activity guidelines for cancer survivorship and for prevention. And what you're going to find is that they're very consistent with some of the remarks that I've made earlier. We want to make sure they have a healthy weight, they're physically active, they're getting lots of balanced intake, they're getting whole grains, they're getting vegetables and fruit, etc. I did want to point out one resource that's out there for cancer survivors. If you're interested, this book is available through the American Cancer Society. The lead author is Catherine Hamilton, and it can give people that opportune information about what they need to do. And much of the research that I've talked about, as well as much of the other research, is summarized for the lay public in this publication. I also want to remind people to feed your children well. And I love this picture, but then after I started looking, I'm going, I wonder if that baby's getting smashed by that watermelon. But I don't think. She looks pretty happy. So make sure that I think, one of the things we need to think about, many of you understand that cancer is associated with family history. That is one of the risk factors. So one of the important messages is that we take the opportune moment when people have been diagnosed with cancer to not only improve their own health and their own decision-making around food, but also to think about their family and their relatives as well. And that's my presentation. Thank you. Is there time for questions?
Yes, absolutely. So please come to the microphones if you have some questions for Dr. Thomas.
Is this working?
There you go.
Hi, I'm Fritz Gombart in the LPI. We study vitamin D. I just want to make a comment that while all these diets are very healthy, the one thing they lack are vitamin D. unless you're eating a lot of salmon or fatty fishes in your diet or getting out in the sun. I know you had it on the slide there, but especially for Oregonians. And vitamin D is really important in fighting cancer as well. There's a lot of evidence for that. We had a nice talk from David Feldman on breast cancer. So I just bring that up so people don't forget about that.
Yeah, and I was trying to focus on whole foods, but that's absolutely, one of the big issues has been adequacy of vitamin D and breast cancer risk. And I actually have a paper that will be published in AJCN in the next several months. I had a graduate student from Saudi Arabia who did a study in Saudi where she looked at cases versus controls, 6-fold greater risk for breast cancer in Saudi women who live in a very sunny climate, but because of the cultural beliefs in terms of clothing are not getting the vitamin D exposure that they need. Mm-hmm.
Hi, thank you for a good talk. I have a question regarding dairy. Because I have been, there's a book out about the breast cancer prevention, non-dairy diet, and you did mention the Asian women who come here and adopt a so-called Western diet, which is, they don't have milk over there, they don't do dairy in Japan and China, they come here and they, and our American diet is so full of it. I mean, in terms of cheese and even if it's non-fat cheese, there's a lot of talk about what cows, the fact that cow milk is for growing cows, and it has high insulin growth factors in it, and it can promote tumors because of that. So I just wanted your opinion.
Yeah, so I think when you look at the association studies, and we actually have no randomized controlled trials, but in terms of the association studies, they're all over the board. And I think part of it is it's hard to sort out fat from dairy. And so a lot of times it's hard to know what the exposure is. And people who may consume a lot of high-fat dairy would also have the body weight factor. So even though we try to tease out those confounders, sometimes it's difficult. Do I tell women to totally avoid dairy? No. I don't think we have evidence of that. But I do tell them to experiment with other milks and other, like nut milks, etc. And I think the other thing is to make them aware that it is a significant source of calories in some people's diets, so you need to be careful. Is there evidence that they should buy organic milk? I don't think there's direct evidence, but I would tell you that a large number of women will decide to go that way, thinking, at least they will help to reduce some of these other exposures somewhat. The other thing I think that, when you talk about Asian women, they also are raised, in fact, exposed in utero to soy and, soy foods at a much higher level than Americans. So, they're not only coming over here and assuming a Western diet, they may be giving up things that may have protected them over the course of their lifetime that may no longer be part of their regular diet.
Much. I wanted to mention that all Japanese women also get something like 85 times the amount of iodine in their diet, about 13 milligrams per day. The RDA level here is 150 milligrams. Iodine is known to prevent the early stages of breast cancer, hyperplasia, and dysplasia. And so I'm wondering if you could comment on that.
Yeah, I didn't, again, go into specific nutrients. I think the data is limited but interesting. And we do have, of course, iodized salt, and we have a lot of women who consume plenty of salt, but it's really hard to in our association studies, it's hard to know how much iodine people are exposed to without doing direct measures, because so many of the food frequency questionnaires that we may ask about may not get to the added salt that people put on at the table or in cooking. Oh, okay.
Thank you. Your statement dealing with childhood obesity and prevention of breast cancer has been extremely weak, which has been surprising for me, because childhood obesity at the prepubertal age, at the age of 5 or 7 years old, is the main cause of early menarche, which in turns is the main cause or a major risk factor because starts the exposure to estrogens, endogenous estrogen, or breast cancer. Can you better focus this topic, please?
Yeah, so what I presented was when you look at the association studies with premenopausal disease versus postmenopausal disease, historically most of the studies have shown that obesity is associated with postmenopausal disease and not as clearly with premenopausal disease. That may have to do with the type of tumors that evolve earlier in life, that they have other exposures beyond obesity that promote those type of tumors more so than the hormone-related tumors that we see later in life that are more likely to be responsive to obesity. I tried to point out the fact that it's not that obesity is okay before menopause, it's just less strongly associated. But in fact, over the last decade, as we've seen more childhood obesity, as we've seen higher body weights, as people approach adulthood and move through adulthood, that quote, that unassociation between premenopausal disease and obesity is less clear. And in fact, we're seeing that obesity is more likely to be associated even with premenopausal disease in today's day and age. So it speaks to probably what you're saying is that we see younger and younger menarche onset. We see young girls reaching that fat mass associated with menarche at a younger age, and that is setting up an increased risk and changing the environment of the breast tissue.
Last question.
I'm curious of your opinion, or if you're familiar with genetically modified foods and cancer proliferation.
That's always a hot topic, huh? Well, so I would say that we basically have no data. I mean, it's a really hard thing to study because a lot of the food that we eat, as you know, in the U.S., it's not labeled. We don't know. When we do a food frequency questionnaire, we don't know whether, we could make assumptions about certain crops, obviously, but we really haven't tried to tease that out well. And I think it's a real hot topic. It's definitely curious to me that the Europeans feel very strongly about making sure we know whether a food is genetically modified or not, and I think people should be able to have that information, but whether we can't at this point say that absolutely if you eat GMOs you're going to be at increased risk for breast cancer. Thank you.
Please join me in thanking Thomson. Great talk.